Hi, this is Dr. Reed Van Ham here. I'm the Chief Technology Officer of ToeFX. I'm going to record a few sessions where I'm going to talk about a few tips and tricks that we learned throughout the years on how to achieve the best outcome from ToeFX treatment. The first one that I wanted to focus on is about debridement. We have in our clinical studies, we had the majority of people that we have recruited were severe cases. We found out that debridement, extensive debridement, is very important for the best outcome for the treatment, meaning that for the first treatment, when the nail is very thick, you need to debride it as much as possible. Throughout the treatment, the following treatments, the nail will soften. It will allow you to further debride. Also, it's highly recommended that each time you take a picture of the patient's toe, mainly the big toe because it's easier to see, and you actually zoom in where you can see all the patches. So where patches are, it means that there is higher concentration of fungus and spores. And those are the sensitive areas where you need to debride further in order to allow a better penetration of the formula. Also around the sides, the lateral of the toe is very important to debride also because this is where more fungus is hiding. Also throughout the treatments, the fungus are stressed out and they are trying to find their way to the proximal area, and you will see lines. So those lines also need to file down. And filing down every time the patient come in and extensively as possible will allow a better outcome of the treatment. And I wanted to share one example. So just give me a moment. So here you see a patient. For obvious reasons, I'm not going to mention his name, but this is his left toe. You see that it's highly infected. In his case, the toe was detached from the nail bed. So during the first or second treatment, actually the nail was filed or removed almost all the way to the nail bed, and you can see it here. This is the second treatment. You see very little of nail. The rest is basically no nail. So this actually, it's a very good example where no nail or as much as possible debridement allow a very good outcome, and this is how it looks after 1 year. So no relapse and full clearance of the nail. So I hope you find it helpful, and I'm going to come back to you with another session. Thank you.